The Ministry of Health is ramping up testing at the border as the number of COVID cases remains at zero. For the 12th consecutive day, there were no new cases of COVID, and there's still only one active case in the country. That means the total number of cases remains at 1,154. Speaking at today's press conference, the Director General of Health, Ashley Bloomfield, says testing remains a fundamental pillar of the country's elimination strategy. From next week, it is proposing to test everyone who returns to New Zealand, including finalising details to test everyone twice over a 14-day period.
The testing is supplementary to the ongoing requirement for the 14 days isolation, either in quarantine if someone's symptomatic or in a managed isolation facility. So it's just, I guess, another belt and braces aspect of making sure we've got really good controls at the border. So none of our existing border measures will be relaxed. And in fact, we are also in discussions with Air New Zealand about the possibility of testing of some of their international air crew, particularly the ones coming in from the USA, which in our view is the highest risk place where our crew are travelling to. We're confident in the measures that are already in place for airline crew, Air New Zealand international airline crew. We're just wanting to look at what other measures, including the role of testing and or a period of self-isolation for international airline crew as part of our overall border measures. And so we're just working through that. It's a conversation. It's not us dictating to them what will be.
Dr Bloomfield says they are also reviewing their current arrangements with international ship crew to ensure New Zealand is meeting their international conventions as well as keeping the borders watertight. On Monday, the Cabinet will consider whether to ease restrictions and place the country under level 1, where there are no requirements for social distancing. But testing remains high and border restrictions continue. Dr Bloomfield wouldn't be drawn on what he will be advising the Cabinet.
It's very encouraging to have had the 12 days in a row of no cases, and clearly that's what we would be wanting to happen. And so I'll be when we first went into alert level 2, my advice was that we spend a full 28-day, that's 2 incubation periods in alert level 2. Given that what we've seen so far, and if that continues, I'll be certainly reviewing that advice and be giving updated advice to Cabinet. I don't want to preempt what that advice will be, but I think that all the signs are good.
And despite the promising test results, he reiterated that elimination is a process rather than a point in time.
And it has these pillars, which include the strict border measures, the widely available testing, rapid case isolation and quick contact tracing. So elimination is not a point in time, and I know there has been speculation on when we might be able to say, here is the point we have eliminated COVID-19. It may well be there is no domestic transmission or domestic onshore infections of COVID-19. It would be great if we reach that point, and it's increasingly looking like we are. But our elimination strategy is ongoing because we clearly still have our measures at the border and a desire to open up the border in a safe way.
Finally, with the onset of winter and with a possible move to level 1, Dr Bloomfield urged anyone with respiratory symptoms to get a free test.